Recording in progress.
Yes, CG, good to go.
Namaskar, everyone, and a very good morning. Welcome, friends, to our weekly virtual Ayurvedic speaker series, the pharmacological and therapeutic effects of top 75 traditional Ayurvedic medicine. Today's our seventh session on Dashmoolarishta, and our special guest this morning is Dr. Bhaswati Bhattacharya. It's a great privilege to have you, Dr. Bhattacharya, with us. Namaskar. And we hosted her in the past. And Dr. Bhattacharya, I would say that without hesitation, she's a true example of our holistic medicine or integrated medicine, which we've been trying to promote for so long. And she has been our guest speaker in the past, and it's a so honor to have you today. A Harvard graduate. She has been recently appointed to NIH, a 24-member committee at National Cancer Institute in USA. It's a very honored position, Dr. Bhattacharya, congratulations. And the objective of that institute is to look away from apart from oncology, what other ways to improve the overall health in the prevention side and the management side of the cancer. I think your insight would be very, very, very enlightening to us. And thank you so very much for your time today. And we're looking forward to your insightful presentation and discussion. And friends, our speakers today are PK Prajapati and Dr. Ramakant Yadav from All India Institute of Ayurveda. We are very much looking forward to your insightful presentation on Dashmoolarishta. And friends, we are very happy to announce that two associations out of US, Ayurvedic Union of Midwest Chicago, Dr. Ashlesha Rautji with us, president of that association. Thank you so very much for joining us and being a part of this initiative. And another one is American Association of Ayurvedic Professionals, California, and Dr. Bhaswati Bhattacharya is the Secretary General of that association also. So friends, this is a platform which we are trying to promote, that how all across the globe, Ayurvedic practitioner associations, practitioners, we can bring on board and have the discussions. There are three things. One is why Ayurveda. Second is how and where. Of course, why Ayurveda, we've been discussing a lot, that what are the various benefits, and then is how we can promote into the various healthcare systems. That is another, I think, debate and questions we have to continue. And where means in what are the low-hanging fruits where we can immediately capture on or capitalize on. And these are the three, I think, areas where when we will start focusing, and we will start getting some of the, in the Western world, these practices to be adopted. And Dr. Bhaswati, of course, a great ambassador of Ayurveda, being herself, PhD in Ayurveda. And we are looking forward to more and more ambassadors like her joining Ayurvedic forum and be carrying this torch forward. So I see Georgie Bhalla from Tathasu also joining. Welcome, Georgie Bhai. Thank you so very much for your promoting the our Ayurvedic speaker series, and it's a collective effort. And we are looking forward to today's exciting presentation. Over to you, Dr. Verma.
And thank you very much, Tishi. Viewers, today we shall discuss a very important Ayurvedic medicine called Dashmoolarishta. As the name indicates, Dashmool, Dash means 10, Mool means roots. So these are there are 10 roots plants in Ayurveda called Dashmoolarishta. So we have two experts, will be enlightening us about the usage of the Dashmoola rest, the pharmacological action, how we can prepare the Dashmoola rest. We have with us Dr. P.K. Prajapati ji from All India Institute of Ayurveda, Delhi. He's a professor there of Bhaishya Kalpana and Ras Shastra. And we have Dr. Ramakant Yadav ji. He's a Kaj Kissa expert, associate professor in All India Institute of Ayurveda, Delhi. So both experts will enlighten us about the pharmacological and therapeutic effects of the Dashmoola rest. And today we have a very special guest, Dr. Bhaswati Bhattacharya ji with us from New York. She is a double PhD. She is a MBBS, MD, and PhD in modern medicine. She is PhD in pharmacology, and she has done PhD in Ayurveda also from BHU. She herself is an example of integration of Ayurveda and modern medicine, and we listen her views about how we can integrate Ayurveda and what are her experiences about Dashmoola rest. So without wasting any time, I'll invite Dr. Madan Thangaveluji to moderate the session. Over to Dr. Madan Thangaveluji. Thank you, sir.
Harishji, namaskar. Thank you very much, Satishji, Pranamji. Thank you very much for bringing us all together on the 7th gathering about traditional Ayurvedic formulations. We've earlier touched on dry formulations, Trifala Churna we've talked about a ghee-based preparation, which was our last one on Brahmi, and in between, we've talked about water alcoholic preparations, which are based on spontaneous natural fermentation of herbs. And today we'll hear about a very complex formulation that uses the roots of 10 different plants, 5 of them hardwood, hard stem plants, and 5 with soft woods. And we have the best of the experts here with us from the relatively recently established powerhouse of Ayurveda for the whole world, based in New Delhi, the All India Institute of Ayurveda. And we are fortunate to have 2 senior professors from there with a lot of experience in both these areas. But most of all, we are very delighted that Dr. Bhaswati Bhattacharya has taken time off to join us here. Welcome, Bhaswati ji. Join us from New York. Bhaswati, we are so fortunate to have you here with us. And I just want to share with our viewers from around the world just a little bit more about Bhaswati. As we said earlier, is a physician scientist in every sense of the word, bringing the wisdom of, and the science of authentic traditional medicine such as Ayurveda back into the hands and hearts of the people. Now, in addition to her academic work at the Cornell Medical College, where she's currently associated with since a long time, and her work at the National Institute of Health's National Cancer Institute on research project related to Ayurveda usage for cancer. So we will hear a little bit more about that. Most of all, Bhaswati ji is the author of a book called Everyday Ayurveda. And this is a book that's been, has a lot of recognition around the world. Bhaswati, congrats to you. It's a national bestseller in India and published by Penguin Random House. And over this period, Bhaswati ji completed a PhD as a Fulbright specialist in global public health, specializing in integrative medicine. Now, you are the best person here, not only as an ambassador, but also as an expert. You've worked at BHU, you worked with the best minds there. Do tell us where we should be going. This is the start of a big adventure in Canada. And you can see all the people who are here taking bold steps to establish Ayurveda in Canada. And Canada might well become the model for the world in terms of Ayurveda in the Western world, partly because Ayurveda is recognized by the federal government of Canada. They've taken a very bold step. They recognize traditional medicine, and in their listing of traditional systems of medicine, Ayurveda appears very proudly and boldly. Where would you like this movement to go. You are based in America, you see a different perspective in your neighboring country.
Dr. Madan, and thank you all for having me. Nice to see a lot of familiar faces. So there's one side that I can speak about, which is the traditional Ayurvedic medical side, the TAM series. But as we start out, let's talk about the interface with the Western world. So when I talk with, for example, the lay audience, which is the majority of the audience that this series is intended for, or when I talk with Western medical doctors, which Harish Verma called MBBS, but we're actually MDs if we graduated from US medical schools. MD students do not learn anything really about Ayurveda. They might not even learn how to pronounce it properly. So for them to pronounce Dashamoolarishta is very difficult. And the first thing they'll say is, well, what does it mean? So it's got 3 parts, as Dr. Madan said. Dasha, which means 10, Mool, which means roots, and Arishtam, which is, well, we translate as a fermentation liquid that's a medicine. And they're lost usually right there. What we need to do in Ayurveda, so I'm going to wear 2 caps back and forth. What we need to do is explain to them in ways that are authentic and accurate, but that make sense to their worldview. And in their worldview, they can understand beer and wine. They can understand different liquors. Many people know how different alcoholic preparations are made that are drinkable beverages or you know, for entertainment purposes. But they don't really understand, unless they are Celts who use bourbon and whiskey medicinally. Most do not understand the use of fermentation medicines. They might have heard of kombucha tea or matcha tea, and these kind of preparations are where I have to start to interface with them. So when I'm speaking with my colleagues at Cornell, if I were to introduce a medicine like Dash-Moolarishta, one of the things I would have to explain to them is what a hydroalcoholic extract is. So just for the mainstream audience, before we hear from Dr. Yadav and Dr. Rajapati, let me just explain this in very layman's terms, that when we talk about hydroalcoholic extracts, they sound like they're very technical and chemical, but this has been going on for thousands of years. We see in the Charaka Samhita about Arishtam and Asava. These 2 terms refer to fermentation, in which you take a bunch of herbs and you boil them in water. So the parts that are dilutable or are, we can say, mixable with water will come out into that water because there's so much water compared to the herb. And with the heat of boiling, that water soluble part will come into the water. The heat will create an effect of opening up more and more of the barriers, the cell walls and the parts of the leaves and the roots that are holding those components, those chemicals intact. And I'm going to talk about the chemical side for a moment. What you'll get is those chemicals that are water soluble coming into the larger body of water. That's like the soup. We call that the decoction because we boil it down, usually from 10 parts to 4. But in this case, I have the BHU Ayurvedic formulary that was written by my PhD guy, Dr. KRC Reddy, and they actually boil it down to 1/10 because Dash-Moolarishta actually has not only several different steps, but there are actually several variations of recipes, which I think the experts will talk about. Once they boil that down and there's that water component, those chemicals that are in the water, the rest of that, the fibrous material and the stuff that wasn't water soluble is taken away. So you only get those chemicals. And then there are other medicines that are added to it, and step by step, it's then added to a container, which is good for fermenting. And we add a fermenting agent, which is not yeast, like a mold or a fungus. We add bacteria from one of 2 flowers, Maduka or the Tataki. And those flowers are considered to be tried and true. Why don't we use roses or marigolds or some other flower? The ancient people worked out that these flowers had the best ingredient that would cause fermentation. And it might be because they watched honeybees, and honeybees are very particular about where they take their pollen from. So this product that is made by the decoction is called arishtam. There's a similar product in which we don't boil and take out the water soluble parts, which is called asava. Both of them are used. We talked about Kumari asava in a previous session of this series. And if you just understand that water is a natural medium, you might think, well, these people were primitive, they only knew water. They also knew how to boil in milk and extract milk soluble. They knew how to boil in ghee. So there's ghee meaning the cow milk derived. They knew how to also extract an oil, usually sesame oil, but also coconut oil. So there are a variety, there are 7 or 8 different medium that are commonly used to extract. Does it mean that they were primitive? No, we need to understand that Dashmoolarishta was worked out as a very elegant recipe because they wanted those particular chemicals. And that's what we're going to hear about today. So when I explain that a hydroalcoholic extract, so the hydro, I explained, the alcoholic is from this natural fermentation process, then they're more open to listening to what Dashmoolarishta is. The next part is the Western medical part. And Dr. Verma and I talked about this week at some length because we have to explain why it is that Dashmoolarishta is good, not only for women's health issues, as was described in the introduction flyer and poster for this session, but also for indigestion, for anemia, for some respiratory conditions, for fistula, for vomiting, for liver diseases, for hemorrhoids, for urinary tract infections, and certainly for vata diseases. I use it for my patients who have cancer. So we're moving into the work that I do in cancer. And I do treat, unfortunately, a lot of cancer patients in the US where most all of them have vata issues. Sometimes it starts in the mind, many times it's also in the gut, but the exhaustion and the anxiety and the vata imbalances are important. How do I explain that to Western medical people? I tell them that I never translated coronavirus as crown microbe. We didn't go around telling everyone crown microbe. We just gave them coronavirus and said, understand what this term means. In the same way, we ask people to just develop their vocabulary and learn what vata pitta kapha is, because it's not air, fire, and earth. It is a principle. It is a physiologic, anatomical, functional principle. And Dashmoolarishta is better described as a medicinal compound that really works well on diseases that have vata imbalance as a key component, rather than trying to give the medical diseases that it works for. If we talk about vata imbalance, and you keep that in your mind as we listen to Dr. Yadav and Dr. Prajapati, and if you have an Ayurveda background, it will completely make sense to you why this amazing drug, Dashmoolarishta, has so many different uses in terms of medical terms. So I have a few other comments that I'll make after the session, but I thought that would just get us oriented if you just understand the basics of what is an arishtam asava and how to talk about it in terms of Western medical language.
Thank you, Bhaswati. Before we go to our 2 eminent speakers, I'm taking the liberty of asking one more small question. Keep it brief so that we can listen to our experts. And the brief question is the engagement with the National Cancer Institute, the Central Council for Research in Ayurvedic Sciences, CCRAS in India, engages with the National Cancer Institute, and that engagement has been going on for some time now. Will they understand what our experts and scholars and the learned, the 5,000 plus years of learning, will they be willing to understand what we mean by vata, pitta, kapha, and what we mean by a hydroalcoholic extract, and what we mean by Brihad panchamoola and Laghu panchamoola, and why do we use the roots for these things? Are they willing to accept these things?
They are, if you explain it to them. So number one, they understand clinical outcomes. So if you show someone, even the doctors, I've had over 100 of the doctors that are working in the central government come to me as students and patients. They will say, I have irritable bowel syndrome, chronic flatulence, hemorrhoids. I have a lot of people have gastritis after taking the COVID vaccine. I have this condition, that condition. I'll say, oh, that's a vata condition, or oh, that's a pitta condition. I'll explain it to them, and then I give them the medicine. The clinical data, practice-based evidence, tends to be the best teacher, and it tends to be the best convincer of Western medical people, because they are taught not to believe in this stuff. That's the first part. The second part is, it's not hard to learn Vata Pitta Kapha. My school in New York specializes in teaching health professionals. So Ashlesha has been one of the teachers. Dr. Verma knows me for years. We know that these people who have very Western backgrounds can learn Vata Pitta Kapha if you can teach it to them in a clear way. So I use examples such as, I talk about the river, and I talk about how the river flows. And when there's wind blowing on the river, how the waves move differently, or when water, like rain, is falling. If you use analogies from nature, this is exactly what my gurus taught me, both in Gurukul when I learned, and Professor Jha when he was teaching me. He would give me examples from nature. There's no reason why Western medical doctors can't learn from examples of nature. We just are not doing it. We meaning the Ayurvedic people, are trying to be very technical and act like they're very professional and convince the Western medical doctors in their language. They don't need it in their language. It's not in their language. They need it in authentic terms, in ways that 5- and 8-year-olds learn about Ayurveda very naturally. They can also learn that.
Thank you, Bhaspati. You know, you are our ambassador there, and we look forward to your ability to open those minds to this way of thinking, a way of thinking and a worldview that's worked well for thousands of years and has a logic within it, is internally consistent, and will continue to offer health and care for the rest of the world, not only in terms of curing disease, but also promoting health, maintaining health, and preventing disease. Now, please stay with us, because we would love to hear more from you after we've listened to our two expert scholars. For those online who are here with us, I would recommend you look through Dr. Bhaswati Bhattacharya's book, Everyday Ayurveda, very easy to access online. If you just Google Bhaswati Bhattacharya and Everyday Ayurveda, it'll take you to a link to the book. And for those who are not aware of our two speakers who are here with us today, I take the liberty of just sharing my screen very briefly. I know there will be a lot of people watching us online, and so for their sake, please do visit the web pages of the All India Institute of Ayurveda in New Delhi. And that's the website, very easy to locate, All India Institute of Ayurveda. It's an autonomous organization under the Ministry of Ayush of the Government of India. As far as we know, there is only one government in the whole world that has an entire ministry for the Ayush systems, and the All India Institute of Ayurveda is one of the key institutions. We can see Professor Prajapati's page here. He comes from the Department of Rasa Shastra and Vaishajya Kalpana. Now, two very complicated tongue twisters here. We will hear from our speakers as to what is Rasa Shastra, what is Vaishajya Kalpana, and most of all about the herbs, the herbal formulation, the 10 herbs that are used, and the rationale for why we have 5 herbs, the Brihad panchamoola that comes from the hard-stemmed plants, and the Laghu panchamoola that comes from the soft-stemmed plants, and the rationale for choosing this. The rationale is much deeper than just chemicals within them. The thinking that has been used to come up with these formulations is what Vaishajya Kalpana is all about, visualizing what herbs are and how to put these herbs together to increase their therapeutic and beneficial effects. So with those words, I think, Harishji, we should welcome our first speaker. I leave it with you, Ji. Thank you. I stop my, thank you. Please unmute, Harishji.
Yes, sir. Please invite Dr. Prajapati.
Okay. So we move on to our first speaker, Prajapati ji. Namaskar.
Namaskar, sir. Namaskar.
Before you start with this, I just want to say this is the power of technology, Prajapati ji. You are seated in New Delhi. I'm seated here in Cambridge in the United Kingdom. Baswati ji is joining us from New York. Ashlesha ji is joining us from Chicago, and the world is connected. People are joining us from Toronto and in Canada, and there are people sitting around the world listening to us. So we are delighted you have found time to join us today. Please tell us a little bit, for the sake, we know who you are, but for the sake of our audience, it's best if you introduce yourself very briefly about where you studied, how you got interested in Rasashastra by Shajikalpana, and then take us into our theme for today. Ji. Namaskar again. Thank you for joining.
Yes, sir. No doubt, good morning, good afternoon, and good evening to all the listeners who are joining online. I respectfully Sri Satish Thakurji, Chair of the CIF, Canadian Indian Foundation, President Dr. Harish Verma ji, and no doubt Madan ji is with us. He is moderating this session. Baswati Bhattacharya ji, he is my guru Bahan because I have also completed my PhD from BHU under our honorable guides, Professor C.B. Jha, and Pallavi Sodhi ji, all the Indian delegates and other countries who are joined on this platform. I welcome all of you. Today, I am no doubt, Rasasastra and Bhasaji Kalpana is a very big terminology, but in Ayurveda, we know it is a very clear science which deals with the metals and minerals, is known as Rasasastra, and herbal formulations is known as Bhasaji Kalpana. So it is a science, though it is available in our ancient literature. But recently, after the incorporation, development of the CCIM, Indian Medical Association, and foundation of the rule and regulation by the Indian government, then it is considered as a separate subject of the Ayurveda. So it is taught in the second year, though many times we are fighting it is a partial clinical and paraclinical and non-clinical. All these drugs, formulations, how to prepare, how to preserve, how to give to the patient, it comes under this particular subject. So, sir, you are sharing my slides, or I myself share?
You are doing it yourself, sir. Thank
Okay,
you.
okay.
I hope you are able to.
Yes.
There is a comment here, Prajapati ji, just
Yes,
very
yes,
briefly, where you did your BAMS and your MD and your PhD, and why you chose this area that you are so passionate about, understanding herbs and understanding how to use them. So
yes.
that young people get an idea. Young people.
I am the graduate, yes, no doubt. I am the graduate of the Gurukul Kangri University under the Gurukul Kangri Ayurveda Haridwar, and MD and PhD from Banaras Hindu University in the subject of Rasasastra. It is a very, the selection of the subject is a very, not a very choice at that time, but no doubt we have selected the Rasasastra of Rasasastra and Bhasaji Kalpana is my second choice after Kaya Chikitsa. And I have got the chance to change my subject during my PG thesis PG studies, but at that time, I have covered 2 months probably in that subject. Then I decided to retain our this subject as Sastra Bhaishaj Kalpana. At that time, it is a very tedious to understand why we are going with the Rasa Sastra and Bhaishaj Kalpana. But as the time goes, we found that we have selected right choice in my life, because it is the branch which deals as a whole of the drug formulations, all the herbs and metals, minerals, and other things also, animal products, marine products, everything. And my choice, my interest is also in that. And it is a very necessary nowadays that it should be come in front of all of you, because it is a very tedious science which can be understood in the terms of the physics, chemistry, biochemistry, and biophysics. Nowadays, somehow it is understandable in that context. So it is a very important branch nowadays, without which it cannot be possible to understand the Ayurveda as a whole. Just a minute, sir. First I share my slides, then we will go in detail. There is a problem.
Apologies for this. Sometimes we do have difficulties with displaying the screen, but it'll be up here soon. Baswati ji, very happy to know that both of you shared the same PhD supervisor in Banaras Hindu University, Professor C.B. Jha, respected Professor C.B. Jha.
He was my mentor. My technical advisor on paper was Dr. K.R.C. Reddy, who really taught me a lot about Bhaishaj Kalpana. And as I mentioned, he has this book, the Ayurvedic formulary book. And in it, because Dr. Jha, but also Dr. Reddy loves to write books. He has like 17 books. He also translates from Telugu and some of the other scripts. So he was able to take the recipes that we actually create in the pharmacy, which Dr. Prajapati also worked in when he was there, and write exactly how it's made, like a cookbook recipe, which you don't see in the classic text, and you also don't see in Sharankar Samhita or any of the modern textbooks. So that was very nice that Dr. Reddy put this together for us and really taught us the steps. I think Dr. Prajapati has his slides up.
Oh, there it is.
Go back to
Thank you. Thank you, Ji. We are there. We just need, if it is possible to display in presentation mode, then our audience will enjoy it even more. Thank you, sir. You are. Thank you. You are now visible. Thank you.
I think you'll just need to unmute yourself, Prajapati ji.
There are two gray areas that, thank you, sir. If you unmute yourself, we'll be able to hear you. Namaskar ji.
Yes, sorry for this.
No mind. There are.
Yes.
Yeah. Delighted to see this lovely building of the All India Institute of Ayurveda in New Delhi.
Yes, sir. Yes, sir. No doubt. It is a great honor for me to be work here at the highest level of the IUS. There is no problem, no doubt. Today we are discussing the pharmacological and therapeutic effects of Dashmoolarishta, especially myself concentrated on the pharmacological and preparation and pharmacological effects of the Dashmoolarishta. Next part, therapeutic effect, is taken by the Dr. Ramakanth Yadavji. So what is the Dashmoolarishta? It is the whole presentation is divided into following outlines, introduction, challenges in preparation, quality control parameters, safety and efficacy. As you know, Vasuvati ji is already told that the Dashmoolarishta is a polyherbal formulations which contains not only 10 Dashmool, 5 Brihad panchamoola and 5 Laghu panchamoola. Brihad panchamoola is 5 plants, bigger plants that acquires the height of more than 20 feet, and 5 Laghu plants, that is a cervix. So in 5 big plants where we can use, it is indicated that the root bark of that plant should be used, but it is a very difficult task nowadays. So it is a challenge how to use the root bark of that plant. And 5 small plants, there is no problem because they are herbs. So whole plant it is used. So 10 plants. The name is also given on this basis, Dashmoolarishta. Dashmool means 10 herbal plants. Is a very popular combination in Ayurveda because Dashmool Kwath is available, Dashmoolarishta is available. Every formulation have around Dashmool is the one ingredient of the Chawanprash also. So it is a very popular formulation which is used in Ayurveda in different dosage form. Here in this formulation, it is the biggest formulation available in our classical literature because starting it contains 55 to 72 ingredients. It is the highest among all Aso and Aristas. These are fermented products. Aso is the fermented product which is prepared with the juices of the herbal plants, and Aristas are the fermented product which are prepared with the decoction of the herbal plants. So this is the minor difference between the Aso and Arista, though there are some discrepancies also there. There's a Draksharishta and Drakshaso. Both are prepared by the decoction of the Draksha. So it is oftenly 1% is there is overlapping there is in our classical literature, but it is have a clear-cut demarcation that Asava is prepared with the fresh juices and Aristas are prepared by the decoction. It is described in Susu Samhita, though it is described in Susu Samhita also, Dashmoolarishta, but exactly the Dashmoolarishta which is popular nowadays and adopted by our government formulary is described by Acharya Sarangdar, that is a 13th century AD, 13th century BC, followed by Bhaisa Ratnaval, Gad Nigra and others also. As we know, there's the nomenclature of the Ayurvedic drugs are generally started with the first ingredient used in the formulation, or on the basis of their action, or on the basis of their quantity. So this is a common practice. Here, Dashmool, this formulation is start from the Dashmool, so its name is given as Dashmoolarishta. At the counterpart, it is a hydroalcoholic fermented product. As we know that the fermentation is an energy yielding process in which the breakdown of the glucose molecules takes place without the initially with the oxidation, but in later stage it is in absence of the oxygen. So it is performed by the yeast, and there are so many materials are used as a yeast fermenting agents like dhatiki, mahua, etc. But most commonly used as a dhatiki, woodfordia, cardifordia. So the chemical process of fermentation, we know, everyone knows that this is the carbohydrate or glucose with the action of the amylase and yeast, it is converted into ethanol, alcoholic. It is the mandatory that this hydrosoluble product is converted into ethanol only, not methanol. So the process should be checked properly throughout the procedure. This is the formulation given in our classics. It is a very long one. I will take some part of this because it is only one part formulation where Acharyas has said that after filtering, the material should be cleaned by a katak seed, nirmalikaran. You find it. Katakasya phalam chiptva rasam nirmalanam tamna. So it is a clear-cut indication that it should be cleared by or filtered properly before using. And it is a product, that's a reference of the Susu Samhita. This is the constitution. When we compile it in the different portions, then we found the 55 drugs in path decoction part, where we have taken the coarse powder and Dravya 1, that's a decoction, Madhu Dravya 2, jaggery and Draksha, Prakshep Dravya 11 Prakshep Dravya are prescribed in this formulation. Sandhani Dravya 1 Dhatiki, and then this part Nirmali Karnarth, this is Katak seed. So it is described in detail with in proper manners. There is no problem. If we got, but there is a problem, challenge, how to obtain the authentic and genuine herbal sample. Because as we starting the Dashamoola, 5 big plants, it is very difficult to collect the root bark of that plant. So in government publications, the root bark is replaced by the stem bark. There is no problem. But in this formulation, Ashtavarg is also prescribed. So it is very difficult to identify the Ashtavarg. So Mahaprakash Nigantu has quoted, in place of Ashtavarg, Pratinidhi Dravya is given. So you find the serial number 47, 48, 49, 50, 51, 52. These are the representative Pratinidhi Dravya of the Ashtavarga. Bidaris, Tavriya, Sugandha, Varahi. You find the 11 Prakshep Dravya with their quantity as specified in API, Ayurvedic Formulary of India. Sweetening agents acts as a nutritive source during the yeast multiplication. The rate of the fermentation and final product directly depends upon this. Just a minute. Nature and concentration of the carbohydrate. Just certainly, we all know that the less amount of the sugar will lead the improper growth of the yeast, which deals with the fermentation, delays the fermentation. At higher amount of glucose level multiply, the yeast was suppressed. This phenomena is known by the glucose repression, glucose catabolite repression, carbon carbolite repression in modern terminology. As Acharya Sarandhar mentioned, and many research work found that after a lot of trial and error, though Acharya has mentioned it in the book, the amount of the solution near about 40% is considered to be the most ideal for fermentation. Though in many formulations we found the 80% of the sugar is mentioned, if sweetening agent is mentioned, then it is a general practice that it should be bifurcated into 2 or 3, 20%, 30%, 40% before mixing it in stepwise. So it is a very, but it is a very difficult task to prepare in that particular correlation. Only experts can do it. Nowadays, initially it is prepared in the earthen pot, and all the materials should be mixed in there and dig into the earth. But nowadays fermenters are available, so we can prepare it. There is no problem. These are the pharmacological, on the basis of Ayurvedic pharmacology, because this terminology is mentioned in our classics. On the basis of rasa, when we calculate it, then we found that out of all the drugs, 18 drugs related to the Madhur Dravya, except Lavarnas, every ras is available here. Madhur 18, Tikta 16, Katu ras is 12, Kasaya ras is 4. On the basis of this, we can take it that the 35% of the drugs are Madhur rasa, 31% of the Katu rasa. On that basis, the Vipaka should be considered and the vipak is the of the madhur and kat. On same basis, on the basis of this rasa guna virya vipak, virya is calculated, that is ushna virya and sita virya. So balance is there everywhere. So it can be used in different conditions. That's why it is the drug which is used in different conditions. Generally, all the herbal drugs are converted into the coarse powder and mixed with the 8 times of the water. Give the swelling, overnight soaking is there. Next day we decoction is prepared. Likewise, after the preparation of the decoction, we add the jaggery and filter it. This daksha is also added in this in the form of quath, madhu, honey. So there is 2 madhu dravya is the jaggery and madhu. Then draksha decoction is also there. So it is mixed properly before putting in any pot. Then we mix the prakshetra dravya and then we mix the sandhani dravya, that's a dhatki in prescribed quantity. This is the flow chart of the preparation of the drug. Firstly, we prepare the quath dravya formulation composition individual through the sieve number 44 to obtain the coarse powder as specified in our AFI. Added a specified amount of the water to soak the overnight. Then heat it on mild heating. Always don't give the severe heat, mild heat. Boiling temperature should be maintained to extract the water soluble extract in proper ratio. It is reduced up to 1/4 and filtered through the muslin cloth to obtain the decoction. By following the same method, quath of the daksha will also be prepared separately. Then we mix it, and in this decoction, we add the jaggery and dissolve it. Then filter it through a muslin cloth or through a filter. Transfer the filter to a clean container. Generally, it is disinfected with the ghee and kali mirch. Fuming is there. So we generally, if it is prepared in the traditional pot, otherwise we take in porcelain jars or plastic jars or steel vessels, then it should be cleaned properly. Otherwise, there is a problem of the fungus development. So the hatki in final powder form, perchep them and seal the mouth of the container for prescribed period. Generally, it is 30 days. And in between 30 days, we check the sign and of the completion of the fermentation process. Generally, we observe that the crackling sound is observed out of the pot. Otherwise, matchstick test, burning matchstick test is checked by this. Or in nowadays, we are fixing a tube, capillary tube to a calcium hydroxide solution, where it comes and it converted into the white color. It shows the presence of the carbon dioxide continuously, because the carbon dioxide is produced during this period. So it should be checked properly. The posology dose of this drug is generally we are using 25 to 30 ml orally with equal amount of the water after meals twice a day, or as prescribed by the physician. The shelf life of this is, as per the DNC Act, is 10 years. Otherwise, it should be taken as there is no shelf life of the alcoholic products, as in modern also. Essential drug list. It is also quoted in essential drug list. It is indication is Vati Vyadhi, Dorvalya, Prasavottar Vyadhi, and doses is 12 to 24 ml after food with water. Precaution, generally there is no contraindications, but it depends upon the practitioners how to use. Preferred in OPD and IPD both, and it is used in different conditions. This is the quality control parameters of the Dashmoolarishta. The color, generally color is dark brown. Odor is very pleasant. Taste certainly sour and sweet. There is no problem because it is a palatable to all, whether it is a children, whether it is a female, whether it is a male, or whether it is an old age patient. There is no problem. It is a very good tasty formulation. So you can use in all the age groups. Generally, total solid content not more than 22% per volume by weight by volume. Refractive index as given in API. So refractive index is 1.4, viscosity is 2.8, specific gravity between 1.05 to 1. Alcohol content generally it is between the 5 to 10%. It is volume by volume. It should be there. And generally, many times we found that this alcohol is not present in this because if it is not prepared properly, then alcohol will not be generated in this formulation. pH is slightly acidic, 4.11. Reducing sugar not less than 40%. And non-reducing sugar not more than 1%. Acid value is 2.8. Methanol is absent. 100% it is absent. So it should be used in certain conditions like the diabetes patients. You can use precautiously. Otherwise, there is a chance of the increase of the blood sugar. So take it in consideration. Total 24 conditions has been described in our classical literature like Grani, Aruchi, Sool, Swas, Kas, Baganda, Vatvyadi, etc. It is said to be, it is said to be Bandhya Pradam Putrad Param. Bandhyanam Putrad Param. Means in case of infertility, whether it is a male or female, both Sukra Bala Para. It is given in the classical literature, and we found that many of the persons are using this. So Dasmoola is in normal physiological process after childbirth, prasyottar in women in the treatment of the piles and in immune system also. And we found in routine, in epidemic conditions, generally we are using Dasmoola in post-COVID patients, and we found very good result in all the conditions because it maintains the hormones of the body, especially in females. So it is a very good drug to use in all the conditions. It is some pharmacological actions proved by the different scholars, and it is published in different type of the journals. It is the experimental evaluation of the analgesic and anti-inflammatory, anti-platelet count potential of the Dashmoola. Dashmoola is demonstrated complete anti-inflammatory and analgesic effect as shown by aspirin. So it is also proved. Evaluation of the oral multi-herbal preparations of Dashmoola on mice model of the osteoarthritis, and oral Dashmoola reduction in the pain disease activity in MI-induced osteoarthritis in mice model. It is proved. Management of the uterine fibroid with the Ayurvedic interventions. Dashmoola is 15 ml BD with the 15 ml water after meal. 3 months with the several other medications it can be used. There is no problem. So comparative free radical scavenging and anti-inflammatory potential of branded market samples of an Ayurvedic formulation Dashmoola. Here the author taken the Dashmoola from the market samples, collected from the market samples and used, and found that Dashmoola formulation showed a significant antioxidant activity and anti-inflammatory potential in all the groups. Standardization of Dashmoola polyherbal formulation, it is also done. Bioactive studies of the individual ingredients of the Dashmoola is also conducted in the pharmacology research lab of the pharmaceutical sciences. So many type of the studies, because it is the most popular formulation available in the Indian markets, and very good, pleasant. The palatability of the formulation is very good, and generally we found in our practice we are using very frequently Dashmoola Quat or Dashmoola. So it is a very popular one. So this is the whole content of the Dasmoola. Thank you to all for a nice patience hearing, and we found that it would justify the presentation because the preparation portion is covered by the quality control and experimental studies. The therapeutic portion is covered by the Dr. Ramakant Yadav, who is the well-known clinician of All India Institute of Ayurveda, and he is the alumni of the BHU also.
Prajapatiji, thank you so much
Thank you
so much for taking us into the depths of this formulation, a very complex formulation. As you correctly say, it has 50 plus ingredients, and our ancient minds who gave us this formulation thought through all the details, including the last step of using clearing nut to clear post-fermentation. And the clearing nut has antibacterial and certain activities that actually helps improve the shelf life, etc. I'll pass the floor to Harishji. There might be a question, but before I draw Harishji in here for the question, there are one or two questions in our chat box, one of which is about the authenticity of this formulation in the markets today. Would you like to comment on this? If it is a sensitive question, then we can move on very quickly to Harishji. But if you want to make a comment or a few words about what is available in the market today, 50 plus ingredients have to go, and they all have to be quality controlled, and there are many manufacturers. And this is the common question from everybody. Who do we buy from? Would you like to make a comment, not about where to buy it from, but the authenticity of a preparation that's in the market?
No doubt, it is a very tedious job to standardize our quality control parameter of this Dasmoola, but it is available. There is no problem, and it is authentic because the Dasmoola is easily available. All the herbal drugs except Kasturi and Ashtavark. Kasturi and Ashtavark. Kasturi is also one of the ingredients of the Prachep Dravya. So, except Kasturi and Ashtavark, everything is available, though it is clearly specified in our classics that in place of the Ashtavark, you can use the Pratinjit Dravya. And it is also indicated in our AFI also. So
there is one question, sir, on this Kasturi. There is a question here about whether the government of India is going to recommend official substitutes can be used. So the substitutes, are there some officially recognized list of substitutes? Is there something that is available?
Yes, till today it is not available, but in near future, within a few months, you can find there's a substitute of the Kasturi should be included in our formulary.
Thank you, sir. Thank you. I think Harishji has some comments.
Thank you, sir. Dr. Prajapatiji, it was an excellent presentation. We have learned a lot. And there are many students all over the world of modern medicine as well as of Ayurveda who are watching you. And they want to learn from you. I have two questions from their side. I'm asking from student side. First of all, the first question is there any limit of alcohol in Assavarist preparation fixed by the Ayush department? Number one. Number two, if the formulation do not comply with the limit, then what happens? Does that sample fails or not? The second question is, you have repeatedly used the word Pratinidhi Dravya, which we call substitute Dravya, so substitute ingredient. As you mentioned, we can substitute Kasturi with something else. We can substitute Ashtavark with the other. Is it legal? Because you are a top expert, you are the top expert, you are advisor to Government of India on Rashastra. And kindly give your opinion. What is the legal status of all these things? Thank you, sir. Thank you very much.
Thank you, sir. Thank you. Very nice question for the present context. The limit of the Assavarist is prescribed in our legal books. There is no problem, sir. It is below 12%, then there is no problem. If it is upper more than 12%, then the packing size should be up to the 100 ml only. So this Dashmoolarishta is available in 450 ml, 200 ml. There is no problem up to the 12%. More than 12%, if the alcohol is more than 12%, then the packing size of the 3 formulations comes under this category. So their packing size is 100 ml only. Certainly, the limit of the alcohol in particular Aso and Arista is prescribed. If exceeds or below, then it will discard it. And NABL accredited labs are there. You can check by this, and if you find anything in this formulation, it is not up to the mark, then it should be withdrawn from the market by the company. It is a provision. So Government of India taking the care of this, and it is prescribed in API. So it is clearly indicated the quality control parameters should be within the normal range of this formulation. And the legal status of Pratinidhi, yes, it is taken. The legal status of the Ashtavarga and some other plants is available in our AFI. There is no problem. Just like in case of Ecodynamic Ferox, Ecodynamic Chesmantham is prescribing. No doubt, till now, the Pratinidhi of the Kasturi is not mentioned in our legal status. So generally, they are in formulations. If it is not available, then the manufacturers are not using any other product, discarding it, and they mention on the label that it is except Kasturi. So there is no problem. It is a legal status.
Thank you, sir. And the last question is, how can we control the percentage of alcohol? Like how much sugar has to be added and how much sugar is converted into alcohol? Is there any idea?
So reducing and non-reducing sugar is the parameter in there. All formulations of the Aso Arista. It gives the indication of the alcohol. How much sugar is converted into alcohol? So it is on that basis we can calculate it. Okay. Otherwise, it is a very difficult task.
Thank you, sir. Thank you.
Okay.
Thank you, sir. Over to Dr. Madanji.
Thank you, Harishji. Thank you. Very, very important questions. Fermentation is a central technology for not only extracting important ingredients from plants, but also for preservation. You know, as Dr. Prajapati says, the shelf life of this formulation, if prepared correctly and to quality standards, is long. I would say, yes. For many, many years, it can be stored. And these are challenges. And also, Harishji, thank you for mentioning that there are students from around the world joining us today with questions, asking, watching us. Our recordings are archived for them to revisit and view at length, at leisure. So whatever information that we can share is for their benefit. And before we move on to our next speaker, Ramakantji, I just, for the sake of our students who are joining us from different places or the curious minds, I just introduce them to the scholarship that is available if they went to the web. Here is a journal, Ayu. This is the official journal of the Institute of Postgraduate Studies in Jamnagar, alma mater for several of our scholars here. And for people who are curious, you can go there, you can do a search. Here is another journal that's published from India, Annals of Ayurvedic Medicine. And again, you can look at the contents there. They're all searchable, freely accessible. The third one I want to highlight is the Ancient Science of Life. Again, a lot of information about deep principles of Ayurveda are listed in there. Journal of Ayurveda and Integrative Medicine. This is another journal published from Bangalore. So for viewers online, you might want, if you're curious to learn what is the work that's going on in Ayurveda, you might want to. Very easy, in this instance, Ayu, a very easy search box, very easy to search. Here you can see 22 publications coming up for the search string Dashamoolarishta. So this is just for those who are joining us and are curious to learn about the contemporary scholarship and where are the details published for Ayurveda. Prajapati-ji, please.
Sir, 3 more journals are available from the NISCARE is also natural products, and 2 journals from the CCRS,
CCRIs.
on drug research and clinical studies. One journal from the IA also case reports, and with journal, certainly we are coming with a good journal, international journal in the form of clinical presentations. So it
And
is
these are all, Prajapati ji, these are all open access. Anybody can access from anywhere.
open access online available. There is no problem.
Thank you, Ji. I'm very happy to have touched on this point. Thank you, Harish Ji, for highlighting students joining us from different places. And this is just to show that Ayurveda and the Ayush is not a light science. It's a very deep and a very vast body of knowledge. The scholarship, contemporary scholarship that's there, as we see from the journals. But for those who have Sanskrit and can understand Sanskrit, they can go into the primary texts. They will enjoy these, the thousands of years of scholarship even more. With those words, we move on to our next speaker. Namaskar Ji. Namaskar Ji. Thank you so much for joining us from New Delhi.
Thanks a lot. Thanks.
Very, very happy to have you here with us. We look forward to learning from you about this formulation, how it's used, the Kaya Chikitsa, the practitioner, how the practitioner uses this. And we look forward to learning from yourself, sir. Thank you again for joining us today. Our audience would once again like to know a little bit more about yourself. You are the best person to present this to them. How you got interested in Ayurveda, how you have enjoyed or not enjoyed Ayurveda, and how come you are today at this wonderful institution, the All India Institute of Ayurveda, India's pride at this point in terms of Ayurveda. Thank you, sir.
Thank you, sir, Dr. Madanji, and all the dignitaries present on this platform. Professor, my senior, Professor P. K. Prajapati ji, Dr. Harish Verma ji, Dr. Baswati ji, Dr. Palluveshwari ji, Dr. Ashlisha Raut ji, and Satish ji, and other dignitaries who are with us in this evening from India, not from all places. So really, as Dr. Madan has asked to give a little bit of my introduction. So I remember my early days in medical school, where we are having a practice to give introduction every time. So that is once again, myself, Dr. Ramakant Yadav, graduated from Lucknow University in 1992, and postgraduated from and PhD from Banaras Hindu University in 1996 and 2003 respectively. I have completed my PhD in 2003. So before joining to this All India Institute of Ayurveda, I have worked for government of Uttar Pradesh for a period of 14 years. And I have also worked as a research officer in Ayurveda in CCRS, that is a well-known institution of Government of India, that is Central Council of Research in Ayurvedic Sciences. I have worked there for around 4 years. And after that, I am here at this prestigious institute, that is the dream project of Government of India, that is All India Institute of Ayurveda, and working here in the capacity of associate professor in the Department of Kaya Chikitsa, that is internal medicine. So this has been a long journey. It took me till date, it is more than 25 years actually, because I post-graduated from BHU in 1996, and my guide was Professor Ramhar Singh ji. I think he is internationally well-known person. Everybody knows him. So that is how I came to this field, and I always have an inclination towards the clinical branches. So I opted for that, and fortunately I got that clinical branch at BHU, and rest is history now. And here also we are having, I am heading the units of musculoskeletal diseases and kidney disorders also. So this is my brief introduction, and definitely I am also continuously giving my efforts to academics as well as clinics also. Thank you. And And as Dr. Prajapati has already given a long introduction about this product that is known as Dashmoolarishta, and virtually he has made my job a little easy, so that everybody is now familiar what is Dashmoola and how it works through different places. May not be possible that everything, maybe some repetitions may be there. So I will try to make it simple, as Dr. Madan has told that our audience is from modern medical school also. So that is a really, I always keep my things very simple and simple to understand. So I think everybody will understand what I want to talk about. So with this, let me share my screen. Yes, whether it is visible.
If you can put it on presentation mode, our audience will enjoy it even more.
Yes.
Thank you, Ji.
Okay.
Perfect.
Yes, as today's topic is about the discussion about this ancient preparation and very popular preparation which is used in our Ayurvedic science since thousands of years, that is Dashmoolarishta. And a lot has been told by Professor P.K. Prajapati sir. So I will going by that. What is Dashmoola? It is a combination of 10 roots, is used widely in Ayurveda for many health conditions related to nerves, muscles, bones, and joints. So this is really important. Apart from what we know, a common belief is that that Dashmoola is only useful for the postpartum conditions or in the dysmenorrhea-like conditions. Not only that, there are a lot of indications which are available for this Dashmoolarishta. It has an potent anti-inflammatory, antioxidant, and anti-analgesic actions. So it has already been explained by Professor P.K. Prajapati sir. So I will not be going in many details about that, but these are the action. I think this is the beauty of this complex Ayurvedic products, which are having more than, you can say, more than 50 or more than 70 ingredients in it. One ingredient is acting on another one thing, and another is on another. So one preparation may be used in different type of conditions also. This is a part of several Ayurvedic medicines and alone used for pain disorders and inflammatory diseases related to musculoskeletal system. So Dashmoola has its beauty, because apart from Dashmoolarishta, there is a group in which it is having only Dashmoola as a content, and we are using as a pain reducing agents in our daily clinics in the patients of arthritis and other conditions also. Also, it is very beneficial in the cases of respiratory diseases. This is also used for reducing the inflammation of lung tissue also. Definitely, this is the Brihad panchamoola. There are 5 big plants known as eagle marmelos or bill, Premna miculata, Agnimantha, Gemelina arborea, Gambhari, Oroxylum indicum, Shionak, Stereospermum suavalens, that is Patla, and botanical names are really given for your reference. And these are the small plants, as told by the Prajapati sir, and that is Shalparni, Prishniparni, Brihati, Kantakari, and Gokshuru. And given that by the name, if you get Desmodium gangeticum, Uraria picta, Solanum indicum, Solanum xanthocarpum, and Tribulus terrestris. So these are the Latin names. You can easily identify these herbs on any sort of medium, whether in the books or whether in the Google platform. You can also go through these plants. Yes, Dashmoolarishta has the power to restore the body from an inflammatory condition to good health by rebuilding the tissues and revitalizing the body, as it has the properties of antioxidant and anti-inflammatory like properties. It has a good quality in reducing the inflammation. Also, it is having a rasayan property. There are many drugs which are working as a rasayan. So a kind of rejuvenation property is also there in the product, that is Dashmoolarishta. This is the process. It's a ray diagram of process, but I will not go into the detail and how, because it has already been discussed by Professor Prajapati sir. How to use this Dashmoolarishta? Take 15 ml to 20 ml Dashmoolarishta, or as directed by the physician. Mix it well with same quantity of lukewarm water. Have this mixture after taking food once or twice in a day for better health. So this is the way by which we are prescribing to the patients. And especially what is we have to understand that it has to be taken with equal amount of water, number one, and it has to be taken after major meals, after lunch or dinner. So these two are the major important factors for using this Dashmoolarishta. Of course, this has to be used with the advice of a proper clinician also. Precautions should be taken while using Dashmoolarishta. There is a common notion that most of the Ayurvedic products are devoid of any side effects or that. But if anything, if you are using which is having some effect, that may cause side effect also. That is also seen with such type of preparations also. If it is not properly prepared, a prepared medicine, that will give a harmful effect to the body. And if it is properly prepared, but you are taking in a overdose form, that will definitely harm. Because I have seen many patients who took these preparations in overdose, that has caused a different kind of presentations. So Dashmoolarishta preparation requires jaggery, which can increase sugar levels in some cases. At definitely, it has sweet contents like jaggery, like honey, and other like grapes. These are the sweet contents which are a part of this preparation. So always use with precaution in cases of diabetic patients, or if possible to avoid that, you may avoid. Number two, in cases of acute gastritis or acidity, this is also had to be taken care of, because it has at least around plus minus 10% of the self-generated alcohol. So this may cause, or this may enhance the ulcerations, you can say, and also gastritis-like conditions it can enhance. So you have to very precaution, take precaution while using in such type of conditions. If a patient is suffering from a disease like GERD, so it has to be taken with precaution. Because of this, I think in classics, it has advised to use after food and along with diluting it in with the water. So this may be a helpful condition. So it would be best to consult your doctor before consuming such type of medicine. So this is how the Dashmoolarishta gives its results. Actions of Arishta in body. This is why this is, I think, most important part. I think this is also a philosophy of Ayurveda, because this alcohol, what Ayurveda said, that alcohol penetrates very fast to different body tissues. You are seeing that if anyone takes ethanol or ethyl alcohol, that is excreted by lungs also. So here this alcohol acts as preservative as well as a vehicle for these substances to facilitate their action on the target tissues. That is very important. Because of that, these all all the grit preparations, as you have told that you have in earlier lectures, you have that were based on the grit preparation. Similarly, these preparations which are alcohol based, they are having a kind of faster effect than the normal vehicles. So that is important. Similarly, these grit drugs, which are more prone for acting towards the brain tissue. So that is important. So this is the importance of choosing a vehicle. Because of that, Dashmoola to get a faster action, I think after a good time of research, Ayurvedic formulations, definitely they have used such type of fermentation or self-generated alcohol as a vehicle to those drugs which can penetrate to the target organ easily. So this is the philosophy behind using such type of fermented and self-generated alcohol products. So ultimately what they done, they normalize the function of dhatu. Dhatu means body tissues, all kind of body tissues where any kind of pathology exists that causes a pacification of this condition. Yes, these are certain publications already. One of them is already quoted by Professor P.K. Prajapati sir. There is experimental evaluation of analgesic, anti-inflammatory, and anti-platelet potential of Dashmoola. This paper is published by JAME, and you have a easy accessibility, as Dr. Madan has said. So you may go through that, and you can you may get all the required information from these papers. And in Dashmoolarishta, definitely these are the contents which are used weight by weight. I will not go into the details of that. These are the content. More than 72 content, about 72 content are there said to be used in Dashmoolarishta, and that is identified by the Ayurvedic formulary of India. And what are the important therapeutic uses which are advocated in our classics are, first of all, aruchi, that is tastelessness. Number 2 is emesis, that is chardi. Number 3 is grahani, that is malabsorption syndrome. Gulm, abdominal lump. Kas, cough. Dyspnea. Shaya, that is a depletion of body tissue, also known as phthisis. And tissue wasting, disease due to vata dosh, and disease due to arsh. So there are many conditions because it has got more than 70 contents. So this is because it has a beautiful effect on different variety of conditions which are having not only on the respiratory system like cough and other, on GIT also, that is MS, tastelessness, and hemorrhoids also. So definitely it has a multi action on the different type of our body tissues. Again, there are many uses, like in fistula, in ano, like in anemia, that is in jaundice also, in the skin disorders also, and in the urinary tract disorder also, and many conditions are described for this. Definitely one that is more and more highlighted is only the infertility part of the this action. So it is widely used by the our female patients, our hospital, and in cases of general debility also it is been widely used for the male patients. And in conditions like where this oligospermia, or where the sperm quality is not good, at that places it has also advised to use Dashmoolarishta for the benefit of the patient. Restoring normal health of postpartum females. This is the most and most practiced part of this Dashmoolarishta. That is, Dashmoolarishta is used in postpartum, the period just after delivery, restoring the normal health of women from ancient times. And taking Dashmoolarishta helps to control aggravation of Vata and restore energy level and optimum health of women because of Vata balancing and Balya, that is strength provider properties. So this property, it has been already everybody advises, not even the doctor. It is so popular, then it has become a household thing. After every delivery, whether it is a poor patient or it is middle class or upper middle class, anybody is there, and whatever the medication he or she is taking, everybody in household always advises that you go for the Dashmoola for 40 days. So around 45 days of period is considered to be critical for that postpartum. So that is so popular for this. Another use that is very widely used by this Dashmoola is it is the pain or cramps caused during the menstrual periods. In Ayurveda, this condition is known as kastartho. Kastartho means pain during the menstrual cycle. According to Ayurveda, artha or menstruation is controlled and governed by Vat dosh. Definitely, it is important to control Vat in order to manage dysmenorrhea. I think everybody might be getting my things because as earlier Doctor said that Dr. Bhaswati, I think, said that it is not always possible to explain the things in the modern terminologies, but we have to understand the terminologies of Ayurveda for a little bit, so that we are able to understand the basic concept of Ayurveda. So that is why this Vat is means that is a significance of one of the body dosh, you can say, one of the vital parts of things in our body that is responsible for all type of nervous like functions. So Dashmoola has Vat balancing property, which provides relief in dysmenorrhea. It controls aggravated Vat and reduces abdominal pain and cramps during the menstrual cycle. So this is the important use that we are always advising. Another that is area where we are using this Dashmool, not always Dashmoola, but these Dashmool in the form of decoction, that is Dashmool Quat, or in the form of vati or tablet, that is Dashmool Ghanvati. We are using in associated conditions like rheumatoid arthritis. Rheumatoid arthritis is known as Amvat in Ayurveda. Amvat is a disease which aggravation of Vadosh and accumulation of Am. That is, Am means nothing very specific. That is, you can say antigen antibody complexes deposited inside the joints take place in the joints. Dashmoola help to reduce Am and controls the Vat due to Vat balancing and Am Pachan digestive properties. So initially, we always prefer Dashmoola for this Pachan. Pachan means digestive action. Always it reduces the levels of toxins in our body. These properties provide relief in the symptoms of rheumatoid arthritis like joint pain and swelling. Also, I have narrated that it is also having a rejuvenation like property, or you can say strengthening property to the tissues. That is also helping there, and it is also having anti-inflammatory like property. So that property also helps in the cases of rheumatoid arthritis. Another condition where we use widely is osteoarthritis. According to Ayurveda, osteoarthritis occurs due to aggravation of Vat dosh, and it is known as Sandhivat. We are aware, most of us are aware that osteoarthritis is a disease of growing age. It is really very common after the age of 50 and 60, and it is also common in the post-menopausal phases. Due to osteoporosis, so it's a you can say it's a condition or basically degenerative conditions which is found in older people. So it causes pain, swelling, and reduces joint mobility. Dashmoola has Vat balancing or Shothar property, that is anti-inflammatory properties, which give relief from symptoms of osteoarthritis like pain and swelling in the joints. We are taking this medicine and giving our patient for reducing the quantity of you can say intensity of pain and swelling of the joints. And definitely in comparison to modern medicine, what we find that this is not as much potent that any of NSAIDs or painkillers which are being used nowadays, but still in longer duration of time, this gives us a desired result. One more condition, that is easy fatigue. A patient is suffering from any kind of fatigue or such type of disorder, Dashmoolarishta is useful to manage fatigue in day-to-day life. Fatigue refers to feeling in tiredness, weakness, or lack of energy. According to Ayurveda, fatigue is referred as a clump. Clump means if you get tired, that is a condition which is known as clump, which is caused due to an imbalance of kapha dosh. Dashmoolarishta helps to reduce symptoms of fatigue due to its balya, that is strength provider properties, and kapha balancing nature. So if you go by these contents, most of the contents of Dashmoolarishta are ushna, that is you can say warm in nature. So that remarkably reducing the kapha dosh in the body. So that causes a kind of strength and to the body tissues, and also reduces the inflammatory process, or you can say inflammatory markers. Evaluation of efficacy of Dashmoolarishta in cervicitis. Definitely, these are certain studies. You may go through that, and I have just given this clue, and you just search on the internet. You will find this full paper, and definitely the study reveals the statistically significant decrease in cervical redness, swelling, low backache. Significant inflammatory changes were observed in pap smear test. ESR was significantly decreased after treatment, and Dashmoolarishta is a potential drug for cervicitis. So this is an important finding in this study. Screening or for performance enhancing substances and quantification of ethanol in different aristos manufactured in Sri Lanka. This is also a very wonderful study which I have found, and really the tested brands like Ashwagandha Arist, Balarist, and Dashmoolarishta did not contain stimulants or anabolic androgenic steroids, because there is a common perception that many of the drugs may act like steroids or that, so it may not be used for a longer period of time. So this study reveals that such type of activity is not present in Dashmoolarishta. So it is really a kind of having minimum side effects for longer use of the condition. Coming to the last of my talk, I will say that Arishta have some characteristic properties like Sukshma, that is subtle, Ushna, that is hot, Vyavai, Vyavai means fast diffusing, so that they are easily assimilated in the body. So any medicine which is given along with this vehicle, that will act relatively faster than other preparations also. And Aristas having Agni Deepan property and are popularly used in different conditions successfully. So definitely this is a wonderful concept of Ayurvedic medicine, that is a concept of Agni. And if Agni of any person, Agni means whatever is the metabolism going on inside the body may be considered as a part and parcel of Agni therapy. And if Agni remains the proper in proper condition or in balanced condition, the person, there is a most of the chances that person will remain healthy for a longer period of time. So balancing this Agni is a major factor which we take in consideration while treating a patient, definitely. So this is important that Dashmoolarishta may regulate the process of Agni also. With these words, I once again thank to the organizers for giving me this opportunity for sharing my thoughts with you all, and really thankful to everyone. Thank you very much.
Thank you so much for sharing, particularly those last few slides where you touched on examples. This is some of the best ways in which we can introduce new minds to the complexity of Ayurveda. You say we use this for conditions like arthritis, let us say, or for kashtartha. And in this way, we can really take people who are new to Ayurveda. They have no idea of Ayurveda, but you can say dysmenorrhea is this, we treat like this. And the curiosity then can be kindled. And from there, the journey begins into Ayurveda. There is a challenge here of how to introduce Ayurveda from the land where Ayurveda came for thousands of years of learning and scholarship into a new land where they don't know what it is. And conditions that are common to mankind might be one of the best ways to make friends. The University Health Network in Toronto will be excited to collaborate with yourself in Delhi into research projects in these areas. Thank you, Ji.
Say that we are having a project on musculoskeletal pain management, and that project is by Government of India and by Ministry of Ayush. And in that project, Spalding Medical School of USA is also one of the contributors in that.
Ramakantji, we would like very much for you to think about how to connect with University Health Networks in Toronto. I'm going to just stop this here briefly because we have Shri Naranji, who's joining us from Delhi. Naranji, the floor is yours. I know you are listening to us and trying to see how to make the governments and the institutes and the researchers talk together so that we can advance this whole area. We look forward to your comments, sir. You are muted, Naranji, we can't hear you. The emphasis here is to see how we can bring governments to work together so that we can get more research or more clinical research.
We will get government to collaborate. I think government is also open to looking at an initiative like this to bring about consensus amongst worldwide practitioners from across the world and bring institutions of research to get them to work together. I think government is open, so we will plan to get various elements of Government of India as well as various other governments to come and participate with that. And we should be able to take this forward. So I understand the technical expertise of the research which is going on, which is what we are serving at this point of time. We should also look at maybe one part of it or maybe alternate part of it to say how do we get global institutions to really help us in mobilizing opinions with the bureaucracy, with the politics and with the policy making across various governments. So that is very essential to really take this and make it a global initiative. I was listening to Baswati ji's feedback on the terminology. That's a very important insight which I learned myself. But there could be many geopolitical nuances to be able to bring about public opinion and be able to build a consensus with WHO and other institutions. So it's a battle which has to be fought along with global allies and together. So we will pursue that. We will also get the Government of India to integrate and participate along with us in taking this forward.
Thank you, Naranji. I want to take just a few seconds from Satish ji. Satish ji, as chair of Canada India Foundation. Satish ji, you can hear the excitement from both sides. From India, researchers are here, clinicians are here, and how we can make this happen with UHN, with the University Health Networks that you are already engaged with, how we can put some of these things also. As Yadavji says, there is already some interaction going on with research teams in USA. Maybe we can extend that to UHN. Is this something we can do? Or
Yes, Madanji. Thank you so very much for all our expert speakers and Bhaswati for giving such insightful presentation. Yes, along with Dr. Harish Verma, we're working with UHN, creating a kind of a steering committee to focus on some of the low-hanging fruits, which I think with the discussions like this, which is happening, helps in terms of mobilizing those, efforts in a very faster way. So I very hopeful that the kind of a ecosystem or environment we are creating. We talked about the, steering the public opinion. I think a platform like this is creating an environment. And if I look at the participants joining every kind of a week, it's growing rapidly. And that in itself showcases that our series is widely getting popularized. I think that environment will help us in mobilizing various institutions, governments to work together collaboratively. And as we all know, this preventative disease management, healthcare, holistic as the integrative approach. It's just a kind of everybody is accepting to it, but don't know how and where to start and how to start. And
Satishji, I'm going to just quickly bring, apologies for interrupting, but to save our time, I want to bring Ashleshji from Chicago. Ashleshji, the challenge here, as Naranji says, getting governments to talk. We won't go into that, but somebody says it is possible. What is the American perspective? So we have, Yadavji has already told us one of the interactions that's going on with America, with the National Cancer Institute that Baswatiji is already interacting with. Can we get some action from Midwest, from Chicago, or your contacts in that part of the world?
Yes, absolutely. And seriously, this is a very important topic, that such a beautiful formulary we have, and we have to do some collaboration there. I think in Midwest, we are open, and things are really getting up open now more, because even the Consulate General of India at Chicago are supporting us in this project of getting and talking more and having that high level dialogue with the main authorities. So in my opinion, things are really getting well shaped up. We have these other dignitaries which are already trying at their levels, and this is a good time that we should further proceed together.
Naranji, would you like to comment? Would you like to comment on that? Because Ashleshji there says the Consul General in Chicago would be very excited about this. Is this something else we can do to?
We should bring the Consul General also to one of our events. Maybe Ashleshji, you can try. I can help too in bringing them to be part of this discussion. It's important that many of our Indian Consul General and High Commissioners to also get educated on this very important subject.
Baswatiji, would you like to add to this about Consul Generals from New York? Is there some way we can excite them, because you are based now in New York? And also, Ramakantji, what was the name of the institution that you have collaboration with in America?
Spalding.
Spalding, okay.
Medical school is there.
Medical school.
We are having a kind of MOU with the Ministry of Ayush. And under that, we are working on a project that is pain management through Ayurveda.
Thank you.
Ayurvedic interventions.
Thank you. Baswatiji, from yourself, I know we are running out of time, but we'll try and pack in. I see there are many more questions, so I'm going to rush through and catch as much as possible. Baswatiji, how to engage with the Consul General in New York? Do you have some ideas?
Yeah, so I was asked to make a list of how we could get involved with policy. So there are events at the Consulate General of India. There is a group of people who have organized around yoga and Ayurveda in this area, New York, New Jersey, Connecticut. And they are looking at events which will not only increase popularity and awareness among the population, but among the people who are lawmakers and policymakers. As you all know, New York is not only home for the Consulate General of India in New York, which is not the embassy, but serves as a very important, large consulate, but also the permanent mission of India to the United States for the United Nations is here. So there's a lot of people moving through. And next month in September, when the general session is held, we have a lot of events, and many of the diplomats who show up come from medical, well, we all know they've all come from medical examinations in New York, and secretly they want to use Ayurveda. So I get called because I'm someone who's both a licensed allopathic physician and also doing Ayurveda. And they say, well, actually, I want to do Ayurveda, but in India, we can't do mixopathy. So I can't say to people in Delhi who are Ayurvedic doctors, because then my people at AIMS will say that, you know, don't use Ayurveda. This is something we need to discuss on the Indian level. And we have 3 people here in Delhi one of the things I do when I'm in Delhi is these soirees. They're small groups of high level, either MLAs, MPs, ministers, people that sit in and around parliament who are perhaps not lawmakers, but are policymakers. And they want to learn about Ayurveda, but they're afraid to ask because they're already supposed to be experts. But when you put them in a small group of 5 to 10 people, last week I just got a call from Jaya Kumarji, who was one of the founders of the World Ayurveda Congress, who's talking about how to get to the youth. So he's creating a couple of initiatives that I'll be involved with, where are getting the youth involved with Ayurveda early on. They're teenagers. Along with that, I've already been working for 3 years with the internship program of the Indian Parliament. So these are young graduates of either law or of political science bachelors who write the law policy for those MPs that introduce it into Parliament. This kind of awareness coming, the language that's coming. I keep telling those young interns they need to go over to people like Dr. Prajapati, go over to AIIA and meet the actual Ayurvedic doctors. And they're afraid. They're afraid because the kind of language that will meet them will be Draksha, Arishta.
Baswati, I'm going to stop you. I'm going to stop you there and just bring our focus back onto the 77th Unga, the General Assembly that's coming together, the 77th General Assembly of the United Nations. And we will chat offline along with Naranji of how to engage a little more fully with the opportunities there. And Naranji, I think this will satisfy a little bit of a question. We will also connect with Satish ji on how to engage in New York a little more for the upcoming General Assembly. And we will try and put a, and Baswati ji, please.
No one has mentioned the Global Center on Traditional Medicines, the WHO.
Of course, that is.
In this session, we've talked about it in past sessions. There's a real opportunity to get all kinds of member countries involved with their interest in indigenous medicines and put something at the General Assembly that says indigenous medicines need to be explored. The GCTM, Global Center for Traditional Medicine, has already been inaugurated, and to have someone from the PAHO, Latin American, someone from Ayurveda, someone from yoga, someone from traditional Chinese medicine to stand together and talk about the need for not just policy, but for awareness of each of the member states, just awareness. Learn what is pharmaceutical medicine, mainstream medicine, conventional medicine, but also learn that there's this other medicine out there that is used by 75% of the people that we're not giving any policy attention to or policy ear to, that we need to be aware of. This is something that we could easily put together for September next month.
Thank you, Baswati. Our permanent representative of India to the United Nations, Ruchira Kamboj. We will connect with Ruchira ji, and we will make this happen, and we will do something, Naranji and all of us.
It's a good idea, Madanji. I think we will get our New York office, the Indian mission there, to we'll invite them for our next session, maybe.
Thank you so much. Thank you, Naranji. I think Harish ji, I think Prajapati ji, please, you can see the speed at which we are throwing ideas. We have to move through.
Yes.
Please, sir.
I request the Canadian consulate to send some request to the House Ministry of Ayush, because nowadays Government of India is very open for the development of the Ayurveda, naturopathy, yoga throughout the world. So if we got any opportunity, then certainly it will go there and establish something. There is no problem.
Thank you, Ji.
WHO already working on this APW project. Terminologies is standardized nowadays. Near future, it will be accepted all over the world. There is no problem.
Thank you, Prajapati ji. Thank you, Ramakant Yadav ji, for showing us where those interactions are happening. I think it's very important. Baswati ji in New York, thank you. We will look to connect with yourself so that we can put a little more engagement, get some more traction with all our Indian missions in New York. And thanks to our chair of CIF, we will put our case in the strongest way so that people know what is happening. And come September, we will have a good presence in New York for this one, Naranji. So this is, I think we have a wonderful outcome for today's event. I want to thank all our speakers who are here. Baswati ji, thank you so much for joining from New York. Ashlesh ji, thank you for joining us from Chicago. We will try and connect with yourself again just to rehearse that interaction with the Consul General in Midwest. And thanks to both our speakers. Prajapati ji, thank you so much for pointing us to some very key areas, not only in terms of that formulation, that seems like that was only an excuse to talk about the real things. And Yadav ji, thank you so much for being with us today. There are many unanswered questions in the chat box. My apologies to all our speakers. The whole idea of these interactions is to provide you a taster about the traditional Ayurvedic formulations, and a taster into the confidence with which our seasoned practitioners are using these formulations on a day-to-day basis and benefiting patients where contemporary medicine may sometimes not provide an answer. And we want to take this message to Canada. We want to take this message to all of North America. We want to take it to the rest of the world. And we look forward to the help from everybody here to realize that wish. So with those few words, I thank everybody here from my side. We look forward to meeting you again next week, next Sunday, where we will be looking at the 8th formulation in our series. Thank you very much. Pallaviji, floor is all yours. Thank you.
Yeah, thank you very much, Dr. Madan. Today's session, the champion formulation about Dashmoolarishta, I just want to give a quick correlation. Dr. Madan has already thanked everybody. The thing is, if you divide your body in the upper part, the chest, the umbilicus, and the lower part, Kati Sthan, what is called the pelvic region. So Dashmoolarishta is mainly working on the Vat Vyadhis, and Kati, the pelvic region, is the Sthan of Vat. Now, Vat is the combination of Akash Mahabhut and Vayu Mahabhut. These certain basic concepts, as we heard Dr. Geeta Krishnan last week about the dictionary being developed to understand Ayurveda very well, I think it would be amazing how to explain the Panch Bhautik concept and the Tridosh, that is Vat Pitta Kapha concept, and how Dashmoolarishta works basically on Vat Vyadhis. And Vat Vyadhi means, doesn't mean ki it is the Vayu. The main property of Vayu, that is Akash and Vayu Mahabhut, is Chalan. So Chalan is the nervous system brings in the movement, the joints bring in movement, and Kati Sthan, the pelvic region, is also where the Kashta Artha, what Dr. Ramakanji mentioned. So it basically works on those areas. So we should try to understand these correlations. It's a beautiful thing, and there's lots to be discussed, but over here, now it's time we all end up and seeking blessings of Lord Dhanvantari. And on behalf of International Ayurvedic League, where Dr. Harish Verma ji is the champion, I thank him. And our special thanks to Bhaspati ma'am for being here and sparing her time. Professor Prajapati, Dr. Ramakant, excellent presentations. And we look forward to joining the International Ayurvedic League group on WhatsApp. And Canada India Foundation, Satish ji, thank you so much. Canadian College of Ayurveda and Yoga, Consulate General of India in Canada, and CAPA, that is Canada College Association of Physicians of Ayurveda. All of them, thank you very much. And today I'm very happy Gregory Bhalla is here from Tathastu. Thank you very much. Narendra ji, you have always been a very important person, playing a very important role in bringing everybody together. And Dr. Ashlesha Rao, thank you very much. And I congratulate OM, that is Ayurveda Union of Midwest, Chicago, who has joined, one of our new collaborators, along with American Association of Ayurvedic Professionals, that is AARP. Bhaswati ma'am, I think, is the Secretary General, and Dr. Vivek Shanbag is the President. So a big applause to them for supporting this platform. Y Media, Pravasi Television, and none other than Dr. Madanji. Thank you very much for moderating, and Dr. Harish, Dr. Narenji, all of you. Next week, we join again to listen to our experts on Ashokarish. Dr. Vermaji.
Yes. Ashokarish.
Yeah. Ashokarish. Okay. So look forward. Thank you very much, everybody.
Namaskar. Namaskar.
Namaskar.
नमस्कार
Good evening.
सभी को नमस्कार
Namaskar.
Satish ji,
Good
pranam
night.
ji, namaskar.
Thank you.
Namaskar.